Hi, I'm often asked the same question, how much vitamin D I'm taking and what brands do I use. And this is because I often talk about the importance of vitamin D and about supplementation of vitamin D. Okay, so I'm Olga, hypnotherapist and coach, and I talk about the importance of vitamin D because it helped me to achieve remission of autoimmune disease of thyroid, Hashimoto's thyroiditis. And in this video, I will talk about in more details about what vitamin D I take and which doses. So, first place, why is vitamin D important? Because it plays a role of hormone, a precursor of hormone in our body, and every cell is responsive to vitamin D, to the hormone synthesized from vitamin D, and it influences our genetics, the transcription of our genes. So it is very important for our health. And 3 reasons to have good levels of vitamin D in your body, blood levels, which is important, is because you will feel much better, because you prevent often colds, infections, and you can prevent chronic diseases, you prevent certain types of cancer, and you can even reverse diseases. You can achieve remission of chronic conditions. So this is very, very important and effective to have good levels of vitamin D. And of course, in summer, you see me expose yourself to the sun. If your sunscreen is blocking UV it will not stop your skin producing vitamin D, okay? Because our skin is endocrine organ. It is producing very important hormone, important for our well-being and health. So now about the supplementation, and the goal of the supplementation is to achieve higher level of vitamin D in your blood, and the target is not simply the norm, but the upper part of the norm, upper half of the norm. This is shown that this level will prevent chronic diseases. It will help you to achieve remissions of any chronic conditions. So it is not just about taking and guessing. You really should know what your levels are and what levels of supplementation help you to achieve this upper norm in your blood. Okay, so this is very important that you test it. And I give you examples why I was thinking, okay, in summer there is more sun, I'm more outside, and then I don't need to take vitamin D. And recently a friend of mine, whom I also urged to test and to see what is happening with her health, and she saw that with even having little children, going out daily with her little children, being outside, she had the very minimum border of the norm in summertime, right? So you wouldn't expect it. And so I was also interested and curious, and just out of curiosity I checked my levels of vitamin D, because I didn't take in summer vitamin D, and I found out also that even if I spend more time and the sun is stronger outside, I had just vitamin D levels in the lower part of the norm, and this is not what I want. And I explained the reasons. I really want to have my vitamin D levels higher. And I started taking vitamin D even in summer. Why? Because if I work at home, in the home office, or in my practice, I'm not outside. Simply, it doesn't matter that there is more sun outside and it is stronger. If you are inside, if you are spending your time inside, if you still work, it's different if you are on holidays. I just got nice tan in Italy, so there I didn't take vitamin D. Okay, but if I work and spend outside just half an hour a day, and maybe only in the evening or in the morning when the sun is weak, then it is, for me, I realized it is important to take supplements of vitamin D. Okay, and then I take 2 supplements. I have a choice of 2 supplements, and both of them, it is a combination of vitamin D and vitamin K, because these vitamins, they work well together. They improve their function when they are together. Okay? And one is just oil containing vitamin D and K, and drops, and I prefer formulations, pure formulations, which have least auxiliary materials, because then they are easy uptaking in my body. Okay, and so just drops without any capsule, without any fillings of tablets, just pure, easy to that, very easy to dose. So I can adjust my dose very easily, 1-2 drops to take. And another formulation is liposomal vitamin D, and liposomal formulation, it improves many aspects of formulations, and especially for vitamin D, it would be the important factor that the larger weight you have, the more fat tissue you will have. Vitamin D, soluble in fat, will dissolve in your fat tissue, so you will be storing it and not using it. Okay, well, I don't have much of fat tissue, so it's not very crucial for me, but this is a factor for you to maybe to think if you would rather take a liposomal, because liposomes will not just dissolve in the fats, they will circulate much longer in the blood, and your other tissues and cells can use more efficiently the vitamin D and K that you take. Okay, so also it's just a fluid, easy to dose and adjust your dosage to your needs. Okay, and yes, so both of them, one dose contains 500% of daily recommended dose. This is 1 milliliter of liposomal formulation or 1 drop of oil. And I found out that for me, in winter time, I have to take even double, so around 1000%, so 25 micrograms is 500%, so I take about 50 micrograms a day. And right, so it is in winter time, and in summertime, if I work and I don't spend time on holidays outside, then I take just a single dosage. Right, and a little bit about the brand. So I don't represent any of these brands. It's just that this is a Dutch good quality brand. I always check if the quality is controlled, if it means independently controlled. So like with this formulation, it's a formulation made in Germany. And yes, so they control quality, let's control them by external laboratories, and yeah, so this will be a higher quality of the supplement. Also, it doesn't matter what name of the brand is. So there is a company, Coral Club. I know it is. You can purchase it almost anywhere in the world, so this would be another opportunity. I prefer, of course, the Dutch brand, because I live and they produce just around the corner these supplements. Yes, so that would be it about the vitamin D, how much I take myself, and the only advice I give to you is go to your doctor and check the levels of the vitamin D in your blood, and then take decision how much you want to take, if you need to take in summertime, and how much you need to take, especially in winter. It can be much more than recommended daily dose. Thank you for your attention, and talk to you next time.